So, sir, I want to understand that how, if a patient comes in, right, with pain, and patients usually are not very good at explaining their symptoms, and neither should we expect them to be. But then the way that they are explaining the symptoms is mostly that they believe it's a toothache, and I think that kind of inclines the doctor into not exploring other diagnoses as well. So, how would you suggest a doctor differentiates between pain to rule out dental pain and like select whether it is TMD or not?
I'm glad you brought it up, and that's very interesting. So there are many situations where patient come up with complaint of sensitive teeth.
सही है.
बहुत सेंसिटिविटी है.
Hmm.
किस दांत में है? इसमें है, राइट साइड पे, लेफ्ट साइड पे. Sometimes they can pinpoint 2-3 teeth. Sometimes they are not able to pinpoint कि कहाँ पे हो रही है.
ठीक है.
But they have sensitive teeth.
Hmm.
And that, and very interestingly, the teeth were not culprit.
Hmm.
It was TMD. The joint was overloaded. They were bruxis, and they have overloaded the teeth. जॉइंट मैनेजमेंट अगर कर ली जाए तो सेंसिटिविटी चली जाती है.
Hmm.
And many of my patients who come up with sensitivity without any organic cause, I look forward for TMD.
Right.
और जिनको TMD लगता है हमें कि TMD है, we go for advise them personal regulation, give them splint therapy, और उससे बहुत कुछ मैनेज हो जाता है.
Right. So should we consider TMD in all cases of bruxism?
No. TMD not always call bruxism does not always lead to TMD, but they have a higher percentage, or it has a potential to cause TMD.
Right. Sir, while you were mentioning some options of management of bruxism that leads to TMD, you mentioned splints, right? I want to understand what do you think are limitations of occlusal splints? Like, what are the kind of patients that you wouldn't give an occlusal splint to?
There's no patient where I don't want to give occlusal splint. If I see it's a TMD, it's always like what type of splint I'm more confident in prescribing.
ठीक है.
ठीक है. Or if I can make impression of TMD patient, I would go for splint therapy. If patient is bruxis, we always like to give them night guard, which is very much supported by the literature. And when I talk about night guard, I always talk about hard night guard, except when required. जिसको bilaminar शीट के ऊपर सेमी हार्ड या सेमी सॉफ्ट आप कह सकते हैं.
ठीक है.
अदरवाइज आई गो फॉर हीट क्योर नाइट गार्ड. हमारा जो जॉ मूव, हम माउथ ओपनिंग होती है, इट्स नॉट वर्टिकल माउथ
Yeah,
ओपनिंग,
it's not.
इट्स मेकिंग सम आर्क, वी शेप है. पोस्टीरियर ओपनिंग कम होती है, एंटीरियर टीथ में ओपनिंग ज्यादा होती है.
Yeah.
If we are making a night guard with thermoplastic material, mean the thickness of the material would be same for the anterior and the posterior teeth.
Yeah, that's not natural.
That is not natural. Mean when the patient when have a night guard and will close his or her mouth, only the posterior teeth will meet, or at least the posterior teeth molar will meet first. The last molar will meet first.